Have you ever gone to the doctor completely exhausted, struggling with your weight, and dealing with skin breakouts only to be told that you are completely fine? That all the tests, the investigations you did, the results came out fine, that nothing is wrong with you. It can be frustrating because you know that something is off, that your body is not feeling fine. So as a nurse, I see these things every time. And the problem is that all those tests that you are doing, the standard tests you are doing, are not looking deep enough. So today, I'll be giving you a checklist of essential lab tests every woman should do annually, because this test will review why behind your symptoms. So test number 1, cervical cancer screening. So this is one of the best ways to detect changes early before it turns into cancer. And there are 2 common screening tests. We have the HPV test and also the pap smear test. So if you're a woman under the age of 21 years or older, you need to start having regular pap smear test done immediately without delay. So during the procedure, your healthcare provider will insert a tool called speculum inside your vagina. So this speculum helps to gently open the vaginal wall to see your cervix clearly. Yes. And a small soft brush is used to collect a few cells from your cervix for testing. Also, if you are 30 to 65 years old, you need to have HPV DNA test done. So this test is used to check for human papilloma virus. That is the virus that is responsible for most cervical cancer. And the good news is that both tests are quick. They usually take few minutes and you are done. So you can just zoom into the hospital, take your test and zoom out of the hospital. But you may feel a little bit pressure or discomfort. But generally, it is not painful. And they could save your life by detecting problems early. Test number 2, sexually transmitted infection screening. So if you are sexually active, like you have started doing some knackings, you need to get tested for STI immediately. Chlamydia, gonorrhea, syphilis, HIV, hepatitis, and so on. You don't have to wait for symptoms. You don't have to wait for your body to start feeling somehow before you get tested. And you might say, I trust the person I'm living with. I trust the person I'm having sex with. I know that you trust the person, but trust can be earned. Yes. So STI can be bad news, silent but still dangerous. So testing is quick. Early treatment can save you and your partner from plenty wahala. I know you trust your husband, you trust your boo, but your boo might not actually be your boo like that. So you need to double check your trust. Test number 3, breast cancer screening. So breast cancer screening is also known as a mammogram. So if you have reached 40 years old, 40, not the ones that we say, 30 is the new 40. No, I'm not talking to those ones. I'm talking to the ones that they will ask, how old are you? You will say, I am 40. Come closer. So once you get to 40 years old, it is advisable to start getting a mammogram done every 1 to 2 years. So a mammogram is an x-ray of your breast. So during the procedure, your breast will be placed in between a plate in a machine for a few seconds. And this machine will gently compress your breast to get a clear image and also check for abnormal changes that could be an early sign of breast cancer. Now, if you have strong family history of breast cancer, it is advisable to start your screening earlier before 40. I know many women will say it is uncomfortable. Yes, it can be. But remember, 20 minutes of discomfort for a mammogram is far better than months of chemotherapy and also cancer treatment. So please, don't skip your screening. It could save your life. Test number 4, diabetes screening, blood sugar test. So as long as you're an adult, it is advisable to check your blood sugar from time to time. And it comes in 2 ways. We have fasting blood sugar and random blood sugar. Fasting blood sugar is usually done in the morning before food. And random blood sugar is usually done after food. So you see this small device here, it is called glucometer. It is used to check your blood sugar. So how to use it? You insert a test strip into the machine. Then you prick the side of your fingertip. So once the blood comes out, you put the blood on the test strip and allow the machine to read. So how do you know that your result is high or low or normal? This chart will help you to understand if your blood sugar is high, if it is low, if it is normal. So once it is high or low, please make an appointment to see your doctor immediately. Early detection prevents complications. Test number 5. Blood pressure. This is one of the easiest things you can do because you can do it in your house, in the hospital, in the pharmacy, even on your street, anywhere. It is a machine called sphygmanometer to use to check your blood pressure. And the thing about blood pressure is that it has no symptoms from the beginning. So it is busy damaging your heart, your kidney, your liver, your brain, your eyes. So it is advisable to check your blood pressure as often as you can, especially for those people that are in a high stressful job. Please do not wait for symptoms. Test number 6. Cholesterol test. This test helps to check the level of fat in your blood. And we have the good cholesterol, we have the bad cholesterol, and the good ones in between. The bad cholesterol doesn't usually have symptoms. Yes, you may have it and you will not know. So, but over time, it can clog your arteries and increase the risk of having heart attack, heart disease, and stroke. So it is advisable to always check your cholesterol regularly because it helps to detect problems early so that you can start treatment on time if needed, and also to make lifestyle changes. Test number 7. Colon cancer screening. So these days we are seeing cases of colon cancer in young adults. So please don't assume that colon cancer is a disease for old people. Please, it's also in young adults. And it is recommended to start testing for colon cancer at the age of 45, but Nigeria says at the age of 30. And during the procedure, your doctor will use a small camera to look inside your colon. And if they see any small growth called polyps, they will remove it immediately before it turns into cancer. That is why screening is very important, because at the early stage, there is no symptom. And when symptom appears, it might be too late, it would have spread, it will be very difficult to treat, and it will cost much more money. Okay? So moving on to the final test. Test number 8. Skin cancer screening. So this is one test that you can actually start at home. Yes, you can do this one at home. So every month, check your skin from your head to your toe. So if you notice any new mole, or the mole that you have before has changed in color, in size, and in shape. Also, please pay attention to any sore that does not heal. So if you notice any of these changes, don't ignore. Please see your dermatologist, because the earlier skin cancer is found, the easier for it to be treated. Okay? Alright guys, if you found my video helpful, please don't forget to click on the subscribe button, like, comment, turn on your post notification bell so that you don't miss any of my video, and also share to your friends and family. I will see you guys in my next video. Bye.